Hi, I'm Dr. Joseph with During, and the purpose of this video today is to talk about the difference between protracted benzodiazepine withdrawal and regular benzodiazepine withdrawal. So let's talk first about regular benzodiazepine withdrawal. Um, this is kind of what the majority of people go through if they don't develop the other kind. Regular benzodiazepine withdrawal is typically characterized by a period of about, I'd say, 7 days. If you do it cold turkey, 7 days of really intense, uncomfortable symptoms, where you can have seizures, you could become delirious, you can hallucinate, and people actually die during regular benzodiazepine withdrawal if they don't taper down very gradually. Usually after the period of about 2 weeks or so, the intense anxiety, confusion, usually they'll have short-term tinnitus as well, maybe some light sensitivity, that will start to dissipate and people will start to feel a lot better. However, people will still have some residual anxiety, which does go on for quite a long time. It'll go on for about 3 months or so where they're still not feeling quite right and they'll still notice improvements. But it's a very smooth trajectory towards improvement the whole time. It's a return to completely normal function afterwards. The contrast to that is the protracted benzodiazepine withdrawal. And this is very different. And so I will say the first thing to note is that, so protracted withdrawal is a constellation of symptoms that people experience when they're on benzodiazepines. Typically, it starts after they've been abruptly withdrawn from a benzodiazepine. They've stopped it cold turkey or, either willingly or unwillingly. Or in rarer cases, but I still see this, it's actually developed while they're still on the medication. They haven't changed the dose at all. And the constellation of symptoms is, it's different. So, and it is kind of an exaggerated, more prolonged version of the typical benzodiazepine withdrawal, but with some changes. So some things that you'll see in the protracted withdrawal really are similar to a kind of a neurological injury. So people will have tinnitus, really loud, disruptive ringing in their ears. They'll have light sensitivity. They'll develop significant muscle spasms and muscle pain and tightness. They'll also develop sensory problems where they'll feel burning in their skin. It's also characterized by difficulty concentrating and focusing, and there's a lot of pretty severe anxiety and depression. Now, the clinical course of a protracted withdrawal is different. It's not this nice linear kind of trajectory towards improvement where, as the months go by, you're getting better and better consistently. It's more, it more happens in waves and windows, as we like to, as is commonly used to describe this in a lot of the benzodiazepine communities. And what that means is after you develop these symptoms and you start to withdraw from your medication and get the benzodiazepine out and really allow the healing to take place, you will have periods where for 2 weeks to 2 months, sometimes longer, sometimes a little less, you'll have really intense symptoms and they'll be very disruptive and there's really kind of not a lot that you can do. I mean, there are some supportive medications that you can give people to make them more comfortable, but you'll have to get through these waves and then they go away and you'll feel a lot better. The symptoms will still be there in the background, but you're doing a lot better. And then you'll have a period of calm, and that may be for a few months, and then you'll have another wave. And typically what happens is as you improve, you'll have less of these waves of really intense symptoms, and they'll become lower and lower, and the times that you're healthier will become longer. The time frame for improvement for a protracted benzodiazepine withdrawal is typically a lot longer. Sometimes it'll take up to a year. For a lot of people, it can take up to a year, but sometimes it can even continue to improve over 3 years to 5 years. So it's not really. I say, when we use the word withdrawal, we kind of think about something that's happening during the acute phase of stopping a medication. A lot of people will have these withdrawal symptoms maybe like a year or two after they've even stopped. So protracted withdrawal, I think, is best thought about as a neurological injury that you've sustained, but that your body is able to recover from with time. So I think those are the key points in differentiating the protracted withdrawal from the typical withdrawal. So I hope it was helpful. I'd love to hear your thoughts and comments below. If I missed anything, please let me know. And thank you for your attention.